Good evening, everyone. I am Augraj Uprety. I am presently now working on Neurocardio Multispecialty Hospital in Viratnagar as a physician. Uh, so now, in this time, every one of us is in panic what to do or what not to, and daily news gives us a lot of information that the cases are being increasing day by day and day by day. Now what to do in this condition? We have something to do is that we should save ourselves and especially save our elderly, especially our parents in our home, because they are having high likelihood of developing any complication due to this disease. So as I guess maximum of us here are in youth or about 20 to 40 years of age. So in that context, our duty lies more to save our parents in our home or the kids. So for that, first of all, we should be less contaminated with the disease or the infection. So how we can do is that, as we all know the theme of social distancing, rather physical distancing that should be maintained at the most. But despite of it, there are some lacunae by virtue of which we can be infected by the virus. So previously, WHO had said that, or many guidelines, especially CDC, WHO had said that there is no role of mask in the public place. But now they have now come with the theme of universal masking, universal using the mask. This has typically been extrapolated by the theme of South Korea, where they showed that they had least or the low amount of infection by use of mask. Now the question arises, which mask should we use at what place? Which mask? So briefly, I'll be describing you at a very simple term that how to use this mask. Presently, the screen shows you is a surgical mask. We all know that we call it as a medical mask or a surgical mask, and we all use it, and we have a type of confidence that after using it we might not get the infection, but that doesn't hold true. The reason is that this surgical mask has been developed to not let the infection be transmitted or not let the droplets be transmitted from the surgeon to the patient. It's not vice versa. So if you are wearing surgical masks, it's high chance that the infection you have inside your lungs or the infection which you are growing in your secretions might not be transmitted to the patient, but the vice versa, that is the infection that a patient or the public will have, that you might not get it can be wrong, because there are a lot of leakage in the mask. If I think maximum of us have used this mask, if you feel that yeah, there is a lot of space from which the air can move inside you, okay, it can escape from you. So this thing should also be thought. So the pseudo confidence, the wrong confidence that after wearing this mask I'm totally safe, is a wrong thing. First thing. Second thing is that how to use this mask. So using this mask means it has a tie, as we all see, it has here a something aluminum film, and it makes it a gripping on over your nasal breeze. Okay, so that is a type of keeping a seal there so that the air leakage won't occur from there. Okay, this is the thing how we will be using this mask. You can use this mask. But for me, if you ask, in our third world, which type of mask should we use when you are going outside in a public place, then I would like to say that this mask is quite sufficient for us. This mask is quite sufficient, and this is a homemade cotton 3-layer mask. Homemade cotton 3-layer mask. So if you are going to the public place, suppose if you are going to the a local tarkari, sorry, a market or a sabji mandi to buy something vegetables, and if you are going like there, then you can use this 3-layer cotton mask. That is quite sufficient for us. Now suppose if you are taking care of a COVID patient, or if a COVID patient is there in your home, or you are taking a patient suspected of respiratory tract infection to the hospital, then you should wear this mask. This is a surgical mask. Why? The reason is that there are two reasons. The first is that the surgical masks should have a type of standardization, and that is typically not present on Nepal and India. The first reason is this thing. And second is that there are false masks also. I'll be discussing you how to find which is the false or a true mask, but there are false surgical masks. So if you wear a false surgical mask, that will be more equivalent to wearing a cotton mask. So albeit of not having so much of standardization, and as there is very less amount of masks available in the society, for the public, WHO and CDC has clearly said to use 3-layer cotton masks. So if you go for a work, 3-layer cotton mask is quite sufficient. And if you are taking care for a patient of COVID patient, or if you are taking a patient to the hospital, then it is this surgical mask or medical mask is used. Now what is this? We all are confused. This is N95 mask, and we all have been seeing watching it that many people use this mask on normal daily activities like going to work, or even in our ministry or in the TV. We all have watched that many ministers are using this, but it is not of use there, because there are two reasons. First thing is that it gets soaked very easily, and second thing is that the virus load is not so much there that you need this mask. So this mask is typically needed for a healthcare profession who are dealing with COVID-19 patient. Now suppose if this mask is being used by non-healthcare professional, then the scarcity of this mask will start to occur. Now, if the scarcity of mask will start to occur, then the healthcare professional will start to harbor the virus. Now, if he or she starts to harbor the virus, any one of us going for non-COVID consultation will come after being cultivated with COVID virus. So now this setup, I think hospitals and healthcare professionals are a source of COVID-19 virus. The reason is that they should properly wear this N95 mask, but there is a scarcity of this mask. So if this mask will be it will be scarcity for them, then they will start to harbor the virus. So this is the reason. This is N95 mask, and the equivalent for it, this N95 mask is typically prepared by United States, and the equivalent for it will be KN95, that will be produced by China. And on the European standard, we have it called FFP2 mask. Now three things. Can we reuse this mask? For cotton mask, you can reuse after washing it properly. Surgical mask, no reuse. Once you use the surgical mask for 4 to 8 hours and it gets soaked, you should be discarding the mask. It has a standard protocol of discarding the mask, and it is being, I think it will be present on the WHO protocol there. You can easily see it from here. And how to disinfect the mask. Now, which mask disinfection? N95 mask disinfection. N95 mask disinfection, if we really are having infected with COVID-19, then N95 mask disinfection can be done by just hanging the mask on sunlight free area for 72 hours. It will be disinfected. For reuse of mask, it's clear. Surgical mask cannot be reused, and your cotton mask can be used after washing. Now, how to differentiate between a fake mask and a true mask? I'll be showing you the video. So this one is the real mask, and this is a fake. Now, if you cut these fake masks, the inside there will be nothing. See, but if you cut the mask, the inside there is a filter, and that in the fake mask it will be easily burnt. See, I'll just be seeing you. This is a fake mask, okay, and we had cut it. The inside we had a filter. This surgical mask also has a 3-layer. Okay, the middle one is the filter by which it filters it. Now, if you burn it, it will be easily burnt. But for a true mask, if you cut it, you'll get a good filter, and if you burn it, it won't burn very easily. This is a one idea. So this is a idea two. Second is that if you put a water test, if you put a water on a true mask, okay, it can hold the water. See, it can hold the water, okay, but a fake mask is that it cannot hold the water. The third one is then something called electrostatic test. It will be a bit difficult, but the real mask will start to absorb it. Okay. And this is that I think it will be a bit of more of difficult test, but the more easy test is by blowing test. If you breathe from a the mask, real mask, you cannot. The reason is that as the true mask has a very good filter, you cannot blow through it. The matchstick or the lighter cannot be blown off. But if you blow from the false mask, it can be blown off. So these are the some ways by how we can differentiate which type of mask is it true or wrong. Okay, now regarding nutrition, I think our last topic, second last topic is regarding nutrition and what thing we should eat or not. The core idea is that the immunity development for a body is a chronic process. It is not going to develop within 1 day or 2 days. Okay, it will take a long time for a development of or a making immunity more better than yesterday. The first thing is that the more natural is the lifestyle, the more powerful will be the immunity. So try to develop your natural lifestyle as far as possible, like the time you wake up, the time we sleep. It's said that early to rise makes a man healthy, wealthy and wise. So the first thing is this. The second thing is that how much daily physical activity are we engaged upon, how much less we are using the lifts, or how much daily we are doing our physical activity, how much daily we are doing exercises. Okay, any part of exercise, either you can run, either you can do gym, either you can do anything. And the third part is that the food, the quality of food what you are eating, like the more natural type of food you are eating, the better is the immunity. Okay, the more homemade food, the better is the immunity. And some of the thing which we have better in the Eastern civilization, like we all have know that turmeric, garlic, ginger, these all are natural antioxidant that try to stabilize your immunity. So that can be taken for your daily need as a context of food. And the last part of our topic regarding is the mental health, which I want to focus is that in the time of any epidemic or a pandemic, being terrified is a very natural thing. So if any one of us is being terrified, don't take it very unnaturally. Suppose there is a fire alarm in the place where you are working, then it's very natural that your heartbeat gets elevated. It is something sympathetic nervous system which says your heartbeat should be elevated. So that's natural. So all of us is being terrified that whether I will get the disease, whether my parents is going to get the disease, where my family member is going to do it. So first thing is take these things very naturally. These are some natural phenomena. Second thing is the excess use of your social media. So we cannot scrutiny which of the social media, the data we are getting up from the social media are really true or not. We just think that everything that we are getting from social media is right, but that's not the truth. There are a lot of things the social media we get a fake thing or a false thing. So I suggest to you all to either get the data or only be believed with those data that you get from authentic source. Like in context of Nepal, we have a specific data from government of Nepal, we have a site there. Second, on internationally, we have CDC, we have WHO, okay, so, or BBC or any authentic channels. We should only believe on those data, not on everything data. And the third thing is that don't over engage yourself on those social media. Like in the morning opening, once you open your channel, you'll get that the today 600 patients have been infected, tomorrow 700, day after tomorrow 800. So this brings something change in your mind. So over being gambling yourself towards that only COVID will also get you on that idea that you are being really, your mind is being infected by COVID-19. So that, and the fourth thing is that a bit for a diversion, I personally, or there are studies also which I recommend you, that we can adjust ourselves on breathing exercise. Like we all have a lot of breathing exercise, like we have all have color therapy, we all have pranayama. So that will a bit help you to stabilize your mind, that uh, that mind, that might not that will not affect the situation, might not affect your mind as it is affecting us. So I think with all this we can control our mental health, and we can be a bit more peace, we can develop a bit more peace than we are having now.
Okay, sir. Thank you, sir. So, just you told about that turmeric based
Yeah,
oil.
yeah, yeah,
So,
yeah.
just people are having lots of turmeric in morning, also in the evening, or in the night in their dinner. So, having too much will affect the promise, create a low blood pressure.
I think too much anything is bad. No, we in our Nepali we all say Amrit pani dherai भयो भने विष हुन्छ. That means if you are taking lot of drug also, it will be like poison. So there is something which should be at a limit. So I had told in my one of video that if you are cooking food for two people, suppose two people, then you just use one teaspoon of turmeric with 2 pinch of black pepper. So that will suffice, and per se it will not be affecting any hypertensive people.
Okay, sir. Uh, Thanks, sir. And one more question you have answered about that. When we wake up, we see the social media. But for the IT profession, the person who is working always on IT on 8 hours, so that has become the habit. So
Yeah,
that
yeah.
how to overcome those habits, sir?
I think personally notifications can be made off. The
Okay.
notifications can be made of. Generally we keep our notifications for the nay, my motto is that if you want to watch, you should be acknowledged that what is happening, that's more important. Because if suppose tomorrow all of a sudden in Nepal 5,000 people are even infected in a one day, then that is a situation of havoc. We should also be terrified with that. I'm not saying that don't be acknowledged with anything, you should be, but once a day is enough. Now in the morning, evening, day, every time per hour you are doing that, that will not glorify your brain, no, that will bring something negativity in your brain. So one time it's enough, two time it's more enough, okay, but more than that will make harm on you.
Okay, sir. Thank you, sir. And so we are at the last of our session. So, what suggestion would you give for IT profession or any other profession who is working? So to stay healthy. So as you have also told that certain things that is fine, but beside your suggestion, what should be what are the things?
Okay, regarding IT profession, which are really the backbone of our science, and the first of all, they should always be healthy physically as well as mentally. So, without being healthy, they cannot give a good output. So, in that context, I would like to say that the first thing is, if maximum time you are spending in a chair, in between that, you should take some amount of walking. Although it might not be possible practically, I don't know or no, but it is situational. But what I do, if really, if you, if talking very personally, or talking a bit professionally or personally, while studying, if I get some about board, I just get up from my chair, I do some out of 30 to 40 push-ups. So that will create a physical change on me, and that will increase the circulation all over my body. Okay, so that can also be extrapolated on our day-to-day activities. Okay, suppose if I am working the whole day in a chair, suppose from morning 9 a.m. to evening 5 p.m. and whole over the spine is always bent, See, our body posture also depends upon the spine. The spine should be straight. Okay, spine is always bent. I'm working on a chair. Then obviously at the end of the day, I'll be very much I'll be fatigued. That is obvious. So to not let that happen, what we can do is we can use some of the time in between for some exercises in between, or walk or something. And the exercise is a must. I say for every patient, not only for diseased, for healthy people, exercise is the must. Beside that, having good food is must. Okay, and proper sleep for the IT people, because they are engaged moreover on the computers, and these computers reflect energy or retina. Okay, so good sleep is very must for them, especially 7 to 9 hours. And obviously the food, the eastern pattern of food which we are daily eating. Okay, and obviously aborting the wrong messages. So if these 5 things could be assembled together, I think we can do fine.
Okay, sir. Thank you. So it was a great, wonderful explanation of your. Yeah, thank you, sir. And mainly, we need to focus on staying healthy,
Yeah.
doing exercise daily, and eating nutritious food.
More
It's yeah.
and a bit more natural lifestyle. I said more natural means what does a natural lifestyle mean? It doesn't mean that let's go from our home and live in a cave. That's not the meaning. I'm saying the more you are stick to nature, the more early you are waking up, the more early you are going to bed. Okay, the thing is, the more you are eating on the daytime and less after the sun is set. It's said that you should eat a breakfast like a king. Okay, we say we have a proverb, no, so we should eat a best amount of our food on the day. And what we have is we make our dinner very heavy, but that affects our digestive system very in a very wrong way. Okay, so our breakfast should be heavy, a lunch should be a bit light, and the dinner should be the least heavy. Okay, so I prefer to all of us to take only, if possible, fruits and a glass of milk. That will be because in the night you won't be doing any exercises, no. So if these can be a more natural lifestyle can be made, then our health will gradually start to be upgrading.
Okay. Okay. Thank you, sir. Thank you, sir, for coming on Take Over the Nepal Series 17.